Welcome to Section 3 of our IV therapy training, IV equipment and supplies. In this section, we'll cover the basic items you'll need to successfully start and maintain an IV infusion, the various infusion devices available, and essential safety tools that protect both the patient and the healthcare provider. Let's begin with the basic IV equipment that you'll encounter in everyday practice. 1. IV catheters, various gauges. IV catheters come in different gauges, typically ranging from 18 gauge, wider lumen, down to 24 gauge, narrower lumen. Choosing the right gauge depends on factors like the patient's vein size, the type of fluid or medication being administered, and the required flow rate. For example, large bore 18 gauge catheters are often used for rapid infusions or trauma settings, while 22 or 24 gauge catheters might be used for pediatric patients or for slower infusions. 2. IV tubing, macro drip, micro drip. Macro drip tubing typically delivers 10 to 20 drops, GTT, per milliliter. It's commonly used for higher volume infusions or thicker fluids. Micro drip tubing delivers 60 drops per milliliter, making it ideal for more precise or slower infusions, such as pediatric or neonatal care. Knowing which tubing to use helps ensure accurate delivery of fluids and medications. 3. IV bags and solution types, crystalloids, colloids. Crystalloids like normal saline, 0.9% sodium chloride, or lactated ringers are the most frequently used solutions. They contain electrolytes and distribute relatively quickly in the body's compartments. Colloids like albumin or dextran contain larger molecules that stay in the intravascular space longer, helping maintain oncotic pressure. Always verify the correct solution and ensure it's compatible with any additives or medications prescribed. 4. Ancillary supplies. Tourniquets to engorge veins, making them easier to see and palpate. Alcohol swabs or chlorhexidine pads to disinfect the insertion site. Dressings like transparent semi-permeable membranes to secure the catheter and protect the site from contamination. Having these basic supplies readily available and organized is essential for efficient IV starts and infusions. In this video, watch how the clinician systematically checks each supply item for integrity, expiration dates, and sterility before assembling them for an IV insertion. Next, let's look at the devices that deliver IV fluids into the patient's bloodstream. 1. Gravity drip systems versus infusion pumps. Gravity drip systems rely on the height of the IV bag above the patient and the tubing's drop factor to control the flow rate. The nurse must manually calculate and adjust drip rates by counting drops per minute. Infusion pumps automatically regulate flow rates, reducing the risk of miscalculations. They're especially useful for precise infusions and for administering critical medications. 2. Automated IV pumps and syringe pumps. Automated IV pumps allow you to program the specific volume and rate. Many pumps also have safety features such as alarms for air in the line or occlusion. Syringe pumps are used to deliver small volumes of medication, often for pediatric patients or high-potency drugs that require exact dosing. These devices provide a higher level of control and safety, but it's important to understand each pump's functionality and alarm systems. Lastly, let's discuss the safety and maintenance tools that protect patient health and reduce the risk of needle stick injuries. 1. Needleless connectors and catheter securement devices. Needleless connectors allow you to administer medications or flush the line without using a sharp needle, significantly reducing the risk of accidental sticks. Securement devices like StatLock or adhesive anchors help keep the IV catheter in place, preventing dislodgement and decreasing the likelihood of site complications such as infiltration or phlebitis. 2. Personal protective equipment, PPE. Wearing gloves, masks, protective eyewear, and gowns as needed helps maintain a sterile environment and minimizes exposure to bloodborne pathogens. Proper usage of PPE is a critical step in infection control and should never be overlooked. That concludes our overview of IV equipment and supplies. In the next section, we'll cover preparation for IV administration, including patient assessment, aseptic technique, and the fundamentals of calculating drip rates.